Solo, and this is a senior citizens forum presented by Benefits for You 2 Insurance Services, where they specialize in Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans. And today we are going to talk about those types of plans and what they are. And I have a guest, which I'm really excited to have on my show because she is the president of Going Solo, and that's Cece Shatz, who is, I'm going to say, a senior who's interested in more information about uh, what is a Medicare supplement, what is a Medicare Advantage plan, and what is a prescription drug plan. But let me tell you a little bit about Cece. She has a major list. I have to read it out. She is a Doyenne of relationship building for divorce, dating, business, and life transformation coach, international internet, radio, TV, and podcast personality. I'm going to be like another friend of hers and go woohoo, okay? And she is president of Going Solo Network, and which is the founder of newstreamingnetwork.com. She's the home of Going Solo and Going Bold TV with over 5 million viewers. That's impressive, okay?
Oh, thank you.
WGSN-DB Going Solo is #1 internet talk and music station. She also has myfriendsconnect.com, interactive and interspiritual community for everyone. Join our groups, connect on New Stream Network. She also has Going Solo Directory.com, which you can join on New Stream Network. She's Going Solo Travelers.com, which is a solo travel club, and WGSN-DB Going Solo Network YouTube, and GoingSoloNetwork.com. We're going to have all the rest of her information up, so if anybody is interested in her shows, you can connect with her. But today we are going to talk about Medicare supplement, Medicare Advantage plans, and prescription drug plans. But the first thing I have to say is that I do not represent or work for Social Security. I do not work for or represent Medicare. That's the Center for Medicare and Medicaid Services. I represent private insurance companies where you can get those Medicare subplans, where you can get those Medicare Advantage plans, and those Medicare prescription drug plans. So we're going to start off, and Cece's going to ask me some questions, and we're going to go through some slides that we've put together for you today. So here we go, Cece. So
first of all, thank you so much for having me on the show. I'm so excited about having it. And yes, I am a senior. And, when I first started to become a senior, right, I knew nothing about any of this. And I'm like, and I still am in the woods about it, which is why I have to go to an expert like you to figure out what the heck I need, right? Because as you can see, I'm extremely busy. And the last thing I need to do is try to read all of the booklets and the pamphlets that you get and the zillion million pieces of mail that we receive on the subject itself. So, again, let's pull up this, like you had mentioned, let's pull this up because I think this will help those out there that are like me that don't know a whole lot about this subject, but let's talk about it.
Oh yeah, we're going to talk about who is eligible for Medicare, right?
Right. So who is eligible?
One of the things I want to say before I start, because it's something that I'm also a senior, and the phone calls haven't been that bad lately. But if anybody gets a phone call from someone saying, Are you happy with your Medicare insurance? Do you know that there's something better out there? And you didn't give them permission to call you, okay? You hang up on them because you need to be talking to someone who you gave permission to call or you made an appointment with, okay? It's real important. And this is one of my pet peeves. It's one of my pet peeves because when I'm a broker and I get people telling me, oh, I made a mistake. I signed up for something I shouldn't have signed up for. So please, and it's just across the board, unless you gave somebody permission to call you, do not give out your personal information. Okay.
Yeah.
Which is really important. So who's eligible for Medicare? That's a really good question to start off with. So we can go to the next slide. Okay. So you can be age 65 or older, which is really simple. Also, people don't realize that if you have a disability and you're under the age of 65 and you're receiving Social Security disability payments for more than 24 months, you qualify for Medicare. And I have quite a few clients that fall into that bracket, that they're under the age of 65. I even have some that they're in their 20s and they are on Social Security disability insurance and they qualify through their parents. So that's real important. So I have several clients that fall underneath that. Also, if you have any illnesses like end-stage renal disease, which is kidney disease, or when you're going on kidney dialysis, and there's certain, or if you have the ALS, and a lot of people will call that the Lou Gehrig disease, and I won't even it's a long name. You're going to qualify fairly quickly for Medicare. Now, the last one here, you need to be a residency. So that means that you need to be living in the United States for 5 consecutive years.
So that would mean, if I understand you correctly, so you could have a green card, right? And live here for 5 years, and then you'd be able to qualify for Medicare or no?
Right. You need to be over 65.
Right.
Okay. So what happened is, and I know this because I did some research for an immigration lawyer, and if you, the United States, I can't remember, I think it's over 500 countries, has reciprocal contracts of people move from one country to the other country, and you've paid into their health systems, that those other countries will move those money into the United States, or vice versa.
Yeah.
So that's how that works, because I've had a lot of people say to me, well, that's not right. Well, no, they're going and asking the country that they came from for that money to help them out.
Right. That's great to know. That's good information.
Okay. So how do you sign up for Medicare? There's several ways. You can go online to www.ssa.gov. You can call the Social Security number at this number that's up here. That's 1-800-772-1213 to apply over the phone or request an application. Okay. Or you can also request an appointment to go to the Social Security office. I always recommend, before you go to the Social Security office, to call and make an appointment. But I have worked with Social Security where I've made a call and I make an appointment and it's all done over the phone. So that's an individual preference and what they feel like that needs to be done. Okay.
That's great. That's great. So we'll go on to the basics.
these are Medicare basics, okay? So original Medicare is broken down into parts A and B. And the A is the hospitalization. So that's if you check in. I always want to say, if you checked into a hotel or you check into the hospital or something that you check into. So when you're going to spend the night that you checked in. But some emergency rooms, you're not checking in because you can spend the night at an emergency room. That doesn't mean that you're checking in. It's when they actually check you into the hospital.
Oh, that's good to know. So just if they keep you in the emergency room, that's not listed, and that would probably. So how would that work? Would that go under like a part of your?
Well, that would go under Part B, under the medical insurance. So if you were to go into the emergency room and they kept you overnight, it's going to be paid under Part B. Okay, and Part B. So Cece, can you guess what else is under Part B besides emergency?
Well, I would think your doctors, going to your doctor's office, your checkups, things like that. I didn't know if your medications, some medications are covered and some aren't.
That's absolutely correct. Absolutely correct. Some medications are covered, and I'm going to go over that in more detail in a couple of minutes, okay? But right now, Part B is basically your outpatient surgery, your emergency room, okay? It's going to be your lab tests, also your durable medical equipment goes under there. So that would be like a wheelchair or oxygen tank, okay? That's going to fall underneath there. Anything that's outpatient, and we'll talk a little bit about that in a few minutes. But you can get additional coverage offered by private insurance companies, which I represent, that have approved contracts with the Center for Medicare and Medicaid Services.
Okay. Now, something that I found out the hard way is that Medicare is not free. But for some reason, I thought when you turn 65, because everybody always said, oh, well, you turn 65, you'll get Medicare. Don't worry about it. You'll get Medicare. And I was thinking, well, it was free. And then when I found out, oh, no, there's a cost to Medicare.
I'm going to go through that in more detail in a couple of minutes. Okay.
So those out there, so when you're thinking about getting a Medicare supplement, there's a reason.
I'm going to go over all of that in a couple of minutes. So You're ahead of me. Great question, but you're ahead of me. Okay.
Yeah. I'm always into the money.
Okay. So just additionally that you can get to go along with your Medicare could be a Medicare supplemental plan, which is also known as a Medigap plan. And you can have or a Part D, which is your prescription drug plan, and which means you can have Part A and B, original Medicare. You can pick up Medicare supplement. And I'm going to say, if you have a good agent, that agent is going to tell you that you need to pick up a Part D plan. And I'll tell you why in a couple of minutes. I keep referring to it in a few seconds, okay? From now. Or you can have a Medicare, keep original Medicare and just pick up a D plan. Okay? Or you can pick up a Medicare Advantage plan. And if you look at the little icons here, you can see that a Medicare Advantage plan includes original Medicare. It includes your doctor's the Part B, and it also includes the prescription drug. Okay, so let's go on to another slide, and let's see if I can answer some of those questions that Cece already asked. Okay, so then we have the Part A, which we said was your hospital insurance. Also, which is included in your Part A, is the skilled nursing facility. It is also your hospice care comes under Part A, and a limited home health care comes under Part A. And that's just for something temporary. So how do you qualify for it? Is there a premium cost? Over all the many years that I have been doing Medicare, which is what we're going on 15 years now, okay? Mostly all of my clients have worked 40 quarters, and then they have no premium for Part A. So you see under here, if you don't have the 40 quarters, these figures are for 2023. What they're going to be for 2024, they haven't come out yet, okay? So it's that's what the figures are going to be. Now, out of all the years that I've done that, I have only had one client that pays a premium for Part A. And not everybody does Part A, because I'm someone that when I'm retired from the city of Los Angeles. And when I worked for the city of Los Angeles, I didn't pay into Social Security. But the city, and I qualified for medical under the city, but
right.
Okay. But I didn't have those 40 quarters. Now I have those 40 quarters. Okay. So not everybody will qualify. Okay. So let's go on to the next. Okay. Part B insurance covers your doctor's visits and your preventive care visits. So what do you think some preventive care would be, Cece?
That's a good question. So preventive care would be, like your wellness visits. You do your, women, we do our mammogram, we do our annual checkups, we do the, all of those kind of things. Those are kind of like your you're not sick, but you're going in to do the testing, to see how you are.
Right. That's true. So did you realize that if you kept original Medicare and without a supplemental plan or Medicare Advantage plan, they only give you one physical exam in a lifetime?
Oh, well, I'm going to live a long time.
Yeah.
So it's like, when do I do that one? Yeah.
Right. That's interesting.
Mm-hmm.
Okay.
Mm-hmm.
So they're diagnostic screenings. So like a lot of your cancer screenings are going to come underneath that.
Mm-hmm.
Okay. Your outpatient surgery, your emergency room care. And one of the other things that people don't realize, if you have original Medicare and you were to travel, let's say to Canada, all right, guess what? They don't recognize that as credible health insurance.
Oh, wow.
So if you were to travel to Europe and all you had was original Medicare and you got sick, you have no health insurance.
Wow.
Original Medicare is only recognized in the United States and its territories. Mm-hmm. So you can go to Alaska and you're going to be covered. But if you go to Canada or British Columbia, you're not going to be covered.
Wow.
Right. So that's always interesting. Okay.
Mm-hmm.
Part B has a premium. This is what Cece was referring to earlier. Okay. And this is going to be, this is pretty much what for 2024, this is what I believe it's going to be for next year also. So if you're a single individual, and this shows you as your tax return, okay, and you make $97,000 or less, or if you're a married couple filing jointly, it's $194,000 or less. Or if you're married filing separately, which is $97,000 or less, you're going to pay $164.90. So you see, as your income, I want to point to it, okay? You see, as your income goes up, your Part B premium increases.
Okay. Yeah, definitely. See how it increases.
So that's what you were talking about earlier.
Mm-hmm.
So yes, Part A, if you paid the 40 quarters, you're not going to have to pay a premium for Part A. But for Part B, you are going to have to pay a premium for Part B.
Right.
Any more questions on that?
No.
Okay. Now, if you don't sign up for Part B when you qualify for it, and so I'm going to tell you, when do you qualify for it? Basically, with the people that were, our audience here is going to be 3 months before your birthday month where you turn 65,
Mm-hmm.
and 3 months after your birthday month. So you have a 7-month window to apply for Part B. Part B has a penalty if you don't apply for it. So if you're working still and you still want to carry your employer's health insurance, I would go in and apply for your Part A. But as long as that employer health insurance is recognized as a credible insurance, you won't get that penalty. So far, I haven't run into anybody in 15 years that hasn't had Part B. Okay. But I do have a lot of people that I've worked with that will pick up Part A, continue to work. They retire, they call me up and they say, I want Part B. You go back and you contact Social Security, you get that Medicare card, and then you give me a call. So that's what that is. It's a monthly premium may go up 10% for each 12-month period that you have not qualified for Part B. Okay? And the exceptions is if you do not have to pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment election period. And that's usually because either you or your spouse have continued to work.
Right.
Okay?
Mm-hmm.
But, okay. Original Medicare doesn't cover everything, which a lot of people don't realize that. So original Medicare doesn't cover the deductibles. It doesn't cover co-insurances. It doesn't cover outpatient prescription drugs. It doesn't cover, as I said, healthcare outside the United States. It doesn't cover those hearing aids or the exams for screenings for the hearing aids or routine eye exams and most glasses. It does not cover that. It also doesn't cover most dental. So over here it says original Medicare generally covers 80% of your hospital and your medical expenses. All right. So here, what is a Medicare supplement? I'm going to go into more details with it. You can fill some of the gaps with original Medicare does not cover. It can also will pick up the deductibles because Medicare supplement plans do have deductibles. Okay. They can have co-pays and co-insurance. You can pretty well go to any doctor. You don't have to worry about networks of doctors. You can go to any doctor that takes original Medicare in the United States. It has a standardized plan letter that's associated with benefits. Now, I know that sounds a little confusing right now, unless you have a supplement and you understand the the different letters in there, but we're going to go into that also. It also has a premium, and that will vary based on your county and your zip code. So, like I know Cece lives in Florida, so her benefits are going to be different on her supplemental plan and cost than where I am here in California.
Right.
And it can be different. So even within the counties in Florida or California, it can be different from one county to the next.
So you really have to go according to your zip code.
They go exactly. They go according to your zip code. So over here are the letters that they're talking about. Okay. So to understand this real quick, if you turned 65 before 2020, the last two columns, you can qualify for C and F. But as of January 1st, 2021, you can't get the C and F plan. You can get all these other plans if they're available in your area. So I'm not really familiar with what's available in Florida, but I know here in California, we're looking at the G plan, which I'm sure they have in Florida. We look at the N plan. And that's basically the two plans that I show my clients, because after that, you can see by these different percentages of what's paid. So when you're looking into your hospital care under a K and L plan, you see that they're only paying 50 to 75% of the costs. And then you have to pay the remainder. And dealing with, with the healthcare system, it's expensive if you don't know what it is.
Yeah, I mean, just to, like, if you have to go 50%, that's a lot. You're going to pay a lot.
So usually, from where I am in California, most of my clients, if they go on to supplemental plans, are going to look at the G plan and the N plan. And if they turn 65 before 2021, they look at the C and the F plan.
Okay.
Because just recently I put somebody into an F plan for a supplemental. Now, one of the things that if you travel, we talked about foreign travel, so this is an important one down here. Most of the plans are going to say right in the supplemental plans, exactly what it is they cover. And most of it is about $50,000. But here I like where they put down they're only covering 80%. So that means that you pay the other 20%. But if you are looking at supplemental plans, I would definitely be asking your broker what that cost is going to be, or if there's a flat rate to that cost. Okay.
Yeah, because, like you said, I have the travel group. And so a lot of people are starting to travel now. We're older and we have the time, or they have the time, I should say. And so they're traveling a lot. So I think you need to think about that, your foreign travel, if that's going to, if your insurance is going to work for you. If not, then you need to come up with some sort of travel insurance or something like that.
Well, some travel insurance. So even if you are traveling, it's only going to cover for the medical. And the travel insurance, I think, is a good thing to have anyway, because if something you have to pay for hospital stay, change your airplane tickets and stuff, you want that extra travel insurance anyway, because this only will cover the medical.
Right.
Okay. What does a Medicare supplement plan not cover? It will not cover prescription drugs. You need to get a separate plan for your prescription drugs. And it has to be a credible plan. And we're going to go more into prescription drugs in a few minutes, okay? All right? You have any questions about that before we move?
No. I
Okay.
got that.
All right.
Okay.
Okay, now we're going right into the prescription drugs. Okay. It provides coverage for some prescription drug costs. And there's two types of prescription drug costs, and they call it Part D. You can get a standalone, or you can get an integrated plan with a Medicare Advantage plan. You must be enrolled in Part A and or Part B and live within the service area. So that means usually with your zip code is going to be your service area. Okay.
Now, can you be covered if you're out of that area? Like, what happens if you go out of that area and you
Okay. Well, I always recommend that before you go out of the area, especially if you're going to be staying someplace for a period of time, that you make sure you have enough medicine, prescription drugs for that period of time that you're gone. Okay. And I know there's limits on drugs and stuff. So if you do go out of the area, you want to find out from that insurance carrier where you can pick up that drug, and you tell them, well, I'm going to go visit my son in Oregon, okay? And I'm planning on staying for 2 months, but I need this. And you work it out. You call that your plan, and you talk with them, and they'll work with you.
Yeah, I actually did that. I stayed with my son for a month, and I get some of my drugs through the mail. I get them through the mail, so I just let them know where I was going to be, and they just sent it to me.
Well,
so
that's an easy way to do that.
Yeah, so you don't have to worry about that. So yeah.
Yeah,
so
but you always have to notify them that you're doing that.
Mm-hmm. Yeah, definitely.
Because I know a lot of drugs have these quantity limits on it, which are not really good.
Because there was a couple of them that I couldn't get renewed. I went to my doctor and asked about that, and so they renewed a lot of them in advance. But then there were a couple they couldn't do. They had to wait because the quantity was already there. So, but yeah. So, not that I take a lot of medicine. Thank goodness I don't. I'm very fortunate. But yeah, there are a few. So.
But if you're going on a vacation, like not visiting a family member or something, and you're going to be gone for a period of time, and you have that luxury to go do that, make sure you have enough medication with you, and let the carrier know that you're doing that, because a lot of the different carriers will help you out throughout those periods, but you have to communicate with them.
Right.
Okay.
Okay.
Also, Part D can also have an extra premium because of your income level. So this is very similar to the Part B, but so if you see you're making again $97,000 or $194,000, you're not going to have any extra premium. But if you're making more than $97,000 to $123,000 as an individual, you're going to see that you're going to pay $12.20 more.
And this is worth it, believe it or not. Let me tell you, you don't realize how expensive these drugs are until you go on them, and then you look at like I see what the insurance pays, and I'm thinking, holy cow. So yeah, it's worth it. It's worth it.
It's worth it. And if you're fortunate enough to make that kind of money, more money than that,
yeah.
I gotta say, everybody should have the problem. Okay.
Yeah, don't talk to us right now. I'm kidding.
I mean, I know people who complain about it, and I'm going, well, what can I tell you?
That's right. It could be worse.
It could be worse. So you also can get a late enrollment penalty, which is something I work with at least once a year, somebody that has a late enrollment penalty. So it says if you didn't sign up when you were first eligible, or you did not have credible coverage for more than 63 days. And I mean, it's crazy when when you find someone that fits into this situation. Maybe they decided that, oh, I'm really healthy, I don't need this, I'll worry about this later. Or I have been with people that say, well, I didn't know I had to have it. Okay. Mm-hmm. So this is real important that you need to know you need that Part D. So if you have a supplemental plan, you need to pick up that Part D plan. And we're going to go into that in a second. But if you don't have it for 63 days, you will get that penalty. And that monthly premium penalty is 1% of the national base premium, which is for 2023 is $32.74 times the number of uncovered months.
Oh dear.
And this does change every year. Mm-hmm. So, and it doesn't go away. Once you get that penalty, it stays with you for the rest of your life.
Yeah, but once you pay it, right? So
you pay it on a monthly basis.
So you pay $32.74 every month.
Well, you pay $32.74. You pay 1% of $32.74. So let me go through this real. I'm glad you're asking.
Yeah, because I don't really. So that's like $3 and almost $4, right?
So that's going to be like for 1% is going to be like $3 and some cents. Okay?
It's $3.27
right, okay.
$3
times the number of months.
Right.
That
so
you're
uncovered.
Right. Because as I said, I do this formula at least once a year. And I must have about 3 or 4 people that are on this. Okay? Because some people won't qualify, or they're going to qualify. They're not, excuse me, I'm getting tongue-tied. There's a way if you make a lower income that you don't have to call. It's called extra help, which we're going to talk about. So
okay. All right. Well, so we do not want this penalty, guys. We don't want this late enrollment penalty.
And there are people that don't realize that they're getting a penalty.
Yeah.
But a lot of people may not pick up. My veterans may not pick up Part D because they will get it at the VA.
Right. Right.
Or if they have TRICARE.
Yeah, my dad had that, the TRICARE.
Right.
Yeah.
Okay.
But he did prior to he had.
Well, because the TRICARE and the VA don't cover everything.
Right. Yeah.
Okay.
All
right. So this is part of your prescription drug. It doesn't matter if you get a standalone policy or you have a Medicare Advantage plan. Everybody goes through the stages. So for those of you that are already have Part D, either through the Medicare Advantage plan or through a standalone plan, these stages are real important. And you get a monthly statement from whoever your carrier is that will explain these stages. And I always tell everybody, you need to review these stages. They're very important, okay? So here, the amount you pay for stage 1. Stage 1 has a deductible. It's either from $0 to $505. For 2024, it will be higher, okay? And it varies according to plan and carrier, all right? Stage 2, it has a total maximum of pay of what you pay and what the plan pays. People get confused. They think, well, it's what you pay alone. It's what you and the plan pay together. So if you look at that monthly statement, they're going to show you what the plan paid. It's going to show you what you paid and what the total costs are of that prescription drug. For 2024, that figure, $4,660, is going to be $5,030. Okay, so it's going to be higher next year. So I really go back to that monthly statement because I think it's so important, and I've actually owed to my clients, and I will review that with them so they understand what that means. All right. So once you spend that for next year's $5,030 for next calendar year, for this calendar year, you see it's $4,660. All right. You spend that, you go into something that's called the coverage gap, or some people will call it the donut hole. But the correct term for it is the coverage gap. Okay. And then your prescription drugs are your cost is going to be 25% of that cost. Again, you're going to see what you pay for and what the plan pays for. So once you and the plan spends $7,400, and that's for 2023, for 2024, that's going to be $8,000. Okay. Then you move into stage 4, which they call the catastrophic coverage, or the MOOP. Okay, maximum out of pocket. All right. And once you do that, then the cost of your drugs you're going to see are going to go back down. This starts over every January. Okay. And not everybody goes through the stages. I have people that have individual plans, standalone plans. They never pay their deductible. They never get out of paying the deductible. If you have a Medicare Advantage plan, you don't have a deductible for it. You start at stage 2. So it's really, really important that you look at that information that when it comes to you, because it tells you where you're going. Because I get that phone call at least 3 times a year. Somebody will say, my drug cost just went up. And I'm going, well, did you look at that? Did you open up that envelope to see where?
That's why I was because I thought I had mine, and that's why I went over to get it. But this was something else. But I thought I never look at it. I just shove it in the to be filed.
All right. And I've gone into people's houses where they have stacks of stuff, and I go through it and I find it, and then I show them what to look for. Not only that, well, I'll go back and I'll talk about something else later. Okay. So it's real important that you look at that, okay? Now, if you're somebody who takes one drug, okay, just look at it, okay? But if you take several different drugs, you want to go through it to find out where you are in the stages. And it really will surprise you what the cost of your drugs are. I've had people say to me, what's the cost of my drug? I have no idea what the cost of your drug is, okay? There's thousands of different drugs. Your agent is not going to know the cost of the drug.
And then it also depends on where you get it at, too.
Absolutely.
Each pharmacy is different. I've learned that. And because the reason I say this is because for years, when I turned 60, I started taking one drug. And then now that I'm older and I got COVID, now I'm taking several, which hopefully will go away. But then I'm shocked with the cost of it all. And so, yeah. So I think that if this is something I think we have to really evaluate every year and not file it away like I've been doing, but we need to really look at it very closely. I agree.
And one of the things that you said, is so important. Even though, you're happy with your plan, you need to look at it because the prescription drugs change every year.
Mm-hmm. Yeah.
And there's going to be a lot of changes next year. I mean, all of a sudden I'll get a phone call in February and say, I just noticed that my premium went up. Yes, there's nothing I can do about that.
So now would really be a good time to look, right? When is the time to change this? When is the time to make these changes if we need to make changes?
Right. Well, you need to do that. I'm going to go over those open enrollment periods.
Okay.
Going into, it's actually going to start October 15th to December 7th, where you should be looking at your Medicare Advantage plans and your prescription drug plans. Okay. Your supplemental plans are a little different. Okay. All right. So, but this is real important. These stages are, I can't even express how important it is to look at it. The cost of your diabetic medications are going to be $35 cap on it, but some of your other medications could be going up if you take it. Again, there's 1,000 different drugs on the formularies, and I will go over what a formulary is in a few minutes. Okay?
We're going to be running out of time here. Maybe we could extend it a little bit, but yeah, go ahead.
Oh my goodness, we haven't got, okay, let's finish the part D, and then maybe we can come and do part 2 of this at another time.
Yeah, we might have to do a part 2, because this is really important, and I'm learning right along with you guys. So I think that this is really valuable information, because like I said, I wasn't taking anything, and now I'm taking something. Like, I will tell you, one drug I'm taking is $45. I thought, oh my gosh, $45 a month I'm paying for this one drug. Then I looked at the cost of it on my insurance, and it's like almost $300. So I'm thinking, okay, I'm not complaining about the 45 now, but the reality is I would have had to pay that 300. And, I mean, it's like, so we really do have to be smart with this stuff. And it's hard to do it, latter part of our lives. We're having to really evaluate it, make good decisions. So, yeah.
I need to finish the part D, and then we're going to have to do a part 2 to this. Okay.
Yeah. Okay.
So part D also has something that's called extra help. So if you are a lower income and you qualify, and that's going to depend again upon area, how the qualifications are. You can go into something for low income subsidy, and you do that through www.ss.gov, benefits, Medicare, prescription drugs, and you sign up for help. They can really help you with that. Let's see if there's another slide, Cece, so we can.
Yeah.
Okay. So I'm not going to go any farther with this, because this is going into part C, and we're out of time. Boy, our time went by really fast. I'm happy to hear that you learned something from this today.
Yeah, definitely. And I'm looking forward to doing the part 2, because here's the thing, is that I don't have the time to keep up on all the ins and outs of this, right? And I think most of our listeners don't either, which is why we go to a professional like yourself to be able to learn the different changes that are taking place, things that we need to do, and maybe things we shouldn't do. And so, yeah, I think that's very, very important. So let's make sure the audience knows how to get a hold of you. And then I wanted to ask you, now I know that you're in California, but can you help anyone?
Say that again?
You're in California and I'm in Florida. Can you still help people in Florida?
Well, I can help them find somebody.
Okay.
Mm-hmm. So, and these rules, doesn't matter. What we're giving you is something very basic.
Yeah.
For this, it doesn't make a difference if you're Alaska or you're in the Hawaiian Islands. It doesn't matter, or any of the territories. These rules, the basic rules, are all the same.
Right. So what you're learning here on today's show, and on the second part that we cover, it's really the basic of the Medicare, like Medicare 101, right?
Well, yeah, but I'm not supposed to use that anymore.
Well, we can't use that. Okay, so Medicare.
So these are the basics for Medicare, for qualifying for Medicare.
Yeah.
These are the basics for Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans.
Right. So you guys, if you want to reach Janice, you can go to Janice at benefits4you2.com. That's benefits, benefits, for you2.com. And that's her website is the same, benefits4you2.com. That's benefits4you2.com.
Yeah,
And then you also have a phone number too. Which phone number would you like for them to have?
if they're calling me about Medicare, they need to call me at 747-205-4364.
Okay. So if you have any other questions about Medicare, then you can give her a call. So awesome. I think this is-
And we will be doing the part 2 very soon. And thank you for watching. And this is WGSN-DB Going Solo Network. And this has been a Senior Citizens Forum. Thank you.
Bye, everyone.